Namaskar and welcome to India Science. In our edition of Question Hour today, we bring you a special program on India's booster drive. When India's COVID 19 vaccination coverage has crossed 153.70 crores and more than 76 lakh vaccine doses have been administered recently, and more than 18 lakh precautionary doses for identified categories for COVID vaccination. But as the COVID 19 continues to surge in India, people are speculating about the booster dose and its effects. In this program, we take your queries also, and we're joined by the very eminent Padma Shri Dr. Saumitra Rawat, HOD Surgical Gastroenterology and Liver Transplant at Ganga Hospital, New Delhi. He's also a member of the COVID task force. Many thanks for joining us, sir. Namaste and welcome.
Thank you, Nidhi. Thanks a lot for inviting me. It's a pleasure and privilege to be on your show.
Thank you, sir. There are a lot of questions that people need to, be answered about. For example, tell us about the booster dose and India's booster drive, sir.
I think it is very important, Nidhi, that we start the booster drive. And what government has done, they have identified the high risk citizen. So they are the healthcare worker and frontline worker, and also citizen who are more than 60-year old and who has got comorbidities. So these are the people who are going to have a booster dose or precautionary dose, and it is started from Monday, which is a very great initiative. And it's important that all the people who are at a high risk take a booster dose. There has been a study in UK which shows that once you take a booster dose, the efficacy of the vaccine increases about 15-20%. So as we see that with time, the efficacy of the vaccine decreases. So booster dose, as the name suggests, it will boost up your protection against the coronavirus.
Absolutely, sir. But how would I know if I need COVID 19 booster dose? And what is the difference between a booster dose and an additional dose?
I think it's one in the same name, Nidhi. I think some place is called booster dose, some place is called precautionary dose, some place is called additional dose, but it remains the same. So it adds to the same thing. It is the third dose which is given in India. That is what is called as a precautionary dose or the booster dose.
So, a lot of people are asking, doctor, on that note, that are COVID 19 booster doses safe? What can you say about the efficacy and the safety of the booster dose, sir?
Nidhi, as you have seen that we had a great vaccination drive, and more than 150 crore of our population is being vaccinated. Till yesterday, it was 152 or 153 crore. So, if there was any significant side effect, we would have seen it till now. So, there is absolutely safe. Vaccine is absolutely safe. And through your channel, I would like to urge and request our citizens that there are loads and loads of people who haven't taken their second dose, crores and crores of our citizens who haven't taken the second dose. I would request them to take a second dose, and all the healthcare worker, frontline worker, and people above 60 years of age who have got a comorbidity, I request them to take a booster or precautionary dose.
Absolutely, sir. Another question that is coming to my mind right now, and I'm sure a lot of people are asking this question, is that can you also specify that if I've taken Covishield or Covaxin, what is the booster that I need to take? Because a lot of people are wondering whether they can, take the other dose, or is it going to be the same dose? What are the guidelines by the GOI, sir?
At the moment, Nidhi, what government has decided is the same vaccine which you have received on your first and second dose, the same is going to be the booster dose. We are doing a lot of studies in our country, which is going to be a local studies regarding the mix and match of the vaccine. Results are going to come in due course of time. Then we will come to know whether the mix and match is going to work or not. There is a couple of studies going out in CMC Vellore. There was a study at AIG, and the government CSIR is also conducting various studies to have a look which vaccine is better. But at the moment, this is going to be the same vaccine. And there has been a study in Oxford as well, where in UK, those who have received similar to the Covishield, which is the same AstraZeneca vaccine, they have seen that once you have given a third dose, the efficacy goes up 15-20%. So booster dose is good. It doesn't have any side effects. Side effects are absolutely minimal. So I urge that people who haven't taken a second dose and those who are eligible for booster dose, they should take.
Absolutely, sir. Dr. Rawat, another point that is being asked by a lot of people is that supposing they are undergoing Omicron like symptoms right now, because it is widespread, then are they eligible for a booster dose or should they wait?
I think it depends on if they are having a typical symptoms, then they should get themselves tested first before they take the vaccine. Because normally, if you get infected, that is also similar to having a vaccine. What I would say, only the healthy people should take the vaccine, not with Omicron symptoms or those who are having a symptom similar to any of the coronavirus symptoms. They should consult their doctors if they are having a symptoms before taking a vaccine.
Yes, doctor. Another important question is on antibodies. We've heard that Covishield produces more antibodies than Covaxin. So people say, is that true? What
I
is the
think it
study that is going on, sir?
I think this is a flaw that one should not go into the antibody titer, because antibody titer is not that important, because there is a memory cells as well. So as long as they have a vaccine, they are protected. And we have seen that even if patients or citizen who have taken a two doses of vaccine, even if they develop a corona infection or Omicron infection, the good thing is the symptoms are mild and there is a very less likelihood of you getting admitted in the hospital. So that is the reason one should have a vaccine. Number one, it prevents. Number two, even if you have an infection, it's going to be a very mild infection.
Yes, doctor. Now that we're talking to you and you're an expert, I'd like to ask you, sir, about treatment of gastrointestinal symptoms in a COVID patient.
Yeah, roughly one fifth of the patient, Nidhi, will have a gastrointestinal symptoms. Normally, they are like anorexia, which is like, they are not feeling hungry. Anorexia, nausea, vomiting, diarrhea, abdominal pain. So these are some of the common gastrointestinal symptoms. During the previous wave also, one fifth or even more than one fifth of the patient, they had a gastrointestinal symptoms. And if symptom continues, then ideally you should get tested for the corona. So these are the common symptoms. So you should not take it lightly if the symptom continues for a couple of days.
Doctor, some people are also asking if you can share about loss of taste and smell by a patient's experiencing this phenomena.
I think in Omicron they have seen that patient is not losing the sense of taste or smell, but in the previous wave we saw a lot of patients losing the taste that, once when they are having a food, it was difficult to, make sure that whether it's salty, sweet, or, losing the smell also, which was quite predominant.
Yes, doctor. Another variant that has come up now, and especially we're hearing about it from France, is the IHU. It has 46 other subvariants. Can you please throw some light on this and what studies are happening?
I think, Nidhi, we need to understand that coronavirus mutate at least two, three, or four times in a month. So there is going to be lots and lots of mutation. This virus was first diagnosed in Marseille in south of France. So in France, they are looking it very deeply. WHO is also on board. They haven't designated this virus as a virus of concern. So at the moment, they are having a look because it's got 46 mutations. So they are looking it very careful. Whether is alpha, beta, gamma, delta, omicron, I think protection remains the same, Nidhi. I think we were very lax about COVID appropriate protocol. I think whenever you are going out of home, you need to wear the mask which should cover the nose and mouth, and you should maintain an adequate distance of 6 feet or 2 gaj, and whenever you touch the external surface, you need to, wash your hand for 20 seconds or sanitize your hand. And whenever your turn comes, you need to take vaccine. The problem is 9% of our population haven't received even single dose. And there has been lots and lots of patients, more than 20 crores, who haven't taken the second dose. So I will request all of them to please take vaccine so that we fight coronavirus together with COVID appropriate protocol and getting vaccinated.
Yes, doctor. But I need to ask you some more questions on your own field, doctor. So tell us about the underlying digestive issues that might put some people at risk in SARS-CoV-2.
I think what happens that, if you have got comorbidity, somebody who's got a diabetes, heart disease, even in GI tract, if somebody got a cirrhosis of the liver, or they have got a infection of hepatitis B or C, or people who have got ulcerative colitis or Crohn's disease, which is an inflammatory bowel disease, they are slightly more at risk of getting a coronavirus. So, they need to be more careful. They need to be more careful.
So, are you saying that COVID-19 will damage the liver if not careful? If so, what precautions or what medicines can such people have? Would you like to suggest some remedies?
I think, obviously what happened that, if somebody had a coronavirus, especially in patient who has got a cirrhosis of liver and who has got a hepatitis B and C, what happened, their liver enzymes rises further. So they are at a higher risk. Even in the normal patient, especially patients who are more than 60 years of age, is been seen that, after they recover from coronavirus, is been seen that they have got a mild raised liver function test, which in due course of time will get better. And in some of the patient, they don't get better because there is a slight damage of the liver as well.
Absolutely, doctor. What about obstruction bleeding? This is quite the phenomena with a lot of people. Could you please explain this in detail?
I think what we have seen that, there has been quite a few cases where the GI symptoms have come after the coronavirus. We have operated on few patients. We operated, during the last wave, we operated a few patients who developed the mesenteric ischemia. That is like when the part of the bowel get damaged, and where is the ischemia of the bowel. This is normally due to microvascular coagulopathy. Some of the patient has come with colonic obstruction as well. There has been couple of cases of acute cholecystitis also. That is an inflammation of the gallbladder after coronavirus. So if you develop a GI symptom, like you are having a pain in the abdomen, or you are having a vomiting, or you are passing blood in the stool, you must consult your doctor. Don't take it lightly.
Absolutely, sir. Please explain pathophysiology. What does that entail?
I think pathophysiology is the inflammation in the case of gallbladder, and also, as I mentioned, it's a microvascular coagulopathy. That after coronavirus, we have also seen there is a slightly high risk, especially in the elder population. We have seen that the patient can have a myocarditis, that is a inflammation of the heart. There is a slightly higher risk of getting heart attack also. That is where the heart vessel, there is a coagulation there. The similar thing is in the GI tract, that these small vessels, there is a clot which is formed in the small vessel, and obviously when the vessel is blocked, that part or that segment of the bowel, in due course of time, become dead. So that is the reason we have to take that part of the small bowel or the large bowel.
Doctor, what about liver transplant patients? How would they cope if they have COVID-19 symptoms? Would the surgery be delayed? Should they come to the hospital on time? Should they wait? What is your advice for such patients?
We have done quite a few of liver transplant during the corona time as well. So normally, is the set protocol. There is a guideline as well that you need to test the patient twice before, for coronavirus, before you do the liver transplant. And obviously, they are on immunosuppressive drugs. So we tell them to be extra careful regarding the coronavirus, so they take proper, adequate COVID appropriate protocol.
Absolutely, sir. And one last question to you before I let you go, sir. How long do we expect booster doses to protect us, and when do you think we would need the next booster?
I think, our country, we have set up a guideline that people can have a booster dose after 9 months of having the second dose. So there is a difference in different countries. If you look at America and UK, they are doing it after 6 months. On one extreme is New Zealand, which is giving a booster dose even after 4 months. So it is, I think, from 4 months to 9 months. We are giving it after 9 months. What we have seen also, that the antibodies level goes down, especially after 6 to 7 months. And I think 9 months is a good time where one should have a booster dose.
Absolutely, sir. And on that note, I'd like to thank you, Dr. Saumitra, for sparing your valuable time and coming out of a surgery to talk to us. Very grateful to you, sir. We'll be back with more interesting editions of Question Hour. Friends, stay with us and stay vaccinated, stay safe. On that note, I thank you on behalf of India Science. Thank you for joining us today. Namaskar.
And thank you very much, Nidhi and India Science, for inviting me.